How's it going, guys? So, a bit of a quick OBGYN question for you. I will cut to the fucking chase and tell you exactly what you need to know for USMLE. Some good, juicy details, okay, regarding some of these answer choices that you probably are not aware of, okay? We'll give you some real, clean, quick value here, okay? It's not hyperbole. So, before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. And find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. And find me on Telegram. Links are also down below. Now let's start the fucking question here, where 4 days after spontaneous vaginal delivery, 28-year-old woman, G2, P2, she comes to the physician, swelling and pain in her right breast. Okay, she's actively breastfeeding. Pregnancy and delivery were uncomplicated. Vitals are within normal limits. Physical exam shows 2 centimeter tender, mobile, fluctuant mass lateral to the right nipple. There is no warmth or erythema. Question is merely asking which of the following is the most likely diagnosis. So why don't we walk backwards through the answers here? Choice E, mastitis, wrong fucking answer. Now, I said there's going to be some juicy details, okay? So, for starters, I should just quickly mention that maybe 4 out of 5 questions, this is going to be your very textbook standard red cracked fissured nipple in a breastfeeding woman, okay? It's classically Staph aureus. Treatment is continue breastfeeding through the affected breast. You can give oral dicloxacillin as the treatment. That's on 2CK material. So that's your classic textbook stuff. Nothing crazy, nothing novel. But 1 out of 5 is you need to know mastitis need not present as the red cracked fissure nipple. It can also present in a woman who's not breastfeeding, and they'll tell you she has an upper outer quadrant non-fluctuant red painful warm mass. Okay, and you say, oh, that's like an abscess. Wrong fucking answer. Non-fluctuant, non-fluctuant, okay? Underline NON, non-fluctuant, that's mastitis, okay? It doesn't have to be red cracked fissure nipple. If they say fluctuant, red, warm, painful / tender mass, that's breast abscess, okay? So I'm going to quickly just say that again. For if they give you an upper outer quadrant lesion, it doesn't have to be upper outer quadrant, but I've seen it in a question like that, okay? If they just tell you a mass in the breast that's red, warm, and tender / painful and it's fluctuant, breast abscess. If it's non-fluctuant, mastitis, okay? That for starters, very juicy info. Galactocele is our correct answer here. Now this is also known as a milk retention cyst, and it can be confused with breast abscess. Here they tell you there's no warmth, nor is there erythema. Okay, these are two important negatives. And vitals are within normal limits. Patient is afebrile. It's not mandatory the patient is febrile if she has an abscess, but no warmth or erythema. This is the USMLE telling you it's not an abscess. Now, in a breastfeeding woman, you can get a milk retention cyst. Classically, it's areolar, okay, be lateral to the nipple. And it can be a tender, mobile, fluctuant mass. Okay, I mean this is what you're learning here. These are factoids. Okay, it's like it's not an abscess if they say it's not warm and it's not red. Okay, and she's afebrile. If they want abscess, they'll say it's fucking warm. They'll say it's red, and they'll say she's febrile. And that's what they're gonna do. Ductal ectasia, wrong fucking answer. This is going to present on USMLE as an inverted nipple, classically. If they don't give you an inverted nipple, I've seen one question where they didn't say inversion of the nipple. They literally said there was like a biopsy performed that showed dilated ducts, which ectasia means dilation. Okay, so dilated ducts, ductal ectasia makes sense, and it's just a benign finding. Breast engorgement, very juicy detail here. This is probably a 270 level question. Now, they are going to tell you a woman just gave birth. They'll say she's not breastfeeding and she has large, tender breasts. And you say, so far, like nothing crazy. What's the big deal? They will tell you she has a fever of 101 or 102. And they'll say that she has dysuria, okay, pain on urination. And they will tell you that her urinary findings and her serum findings are completely normal. So she does not have leukocytosis. She does not have white blood cells or bacteria in the urine. And they'll have other answers like cystitis. Okay, wrong fucking answers. Okay, very difficult question. You say dysuria and she's got a fever. I mean, that sounds like it could be a UTI, even if there's no white blood cells or bacteria in the urine. I'm telling you, okay, breast engorgement will show up as a woman who's got a low grade fever, and she's going to have normal serum and urinary findings, okay? Why it causes fever exactly? No fucking idea. Okay, but I'm telling you what shows up on the NBME. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel. And I appreciate your time. That's it.